In this video, we'll discuss about that cardiovascular system. Last one is antihypertensive drugs. How many drugs used in hypertension? In hypertension, we use 5 drugs, out of which fours are first line. First 4 are first line, and the last one, fifth one, is second line drug. So, what are the 5 drugs? A, B, C, D. These are the first line drugs in hypertension plus vasodilator. These one are the fifth drugs. What is A, B, C, D? A for ACE inhibitor and ARBs. These drugs which inhibit RAS. Which is better? Which one is better? ARB is better because they don't cause edema. ARS better because this one don't cause edema, cough, then itching, then it don't cause taste disturbance. So this one don't inhibit the degradation of bradykinin also. So and comparing to ACE, this ARBS is the best one. Then B for beta blocker, C for calcium channel blockers, D for diuretics, and fifth one B, vasodilator. So these are the 5 category of drugs we are having. So first one is ACE inhibitor and ARBS. Here the drugs which inhibit RAS, ACE inhibitor and angiotensin receptor blockers. This ACE inhibitor, all the drugs suffix bril. So catobril, elazinogrel, then usinobril, peritobril, ramibril, fosinobril, quinofril, and tranatobril. So these are the drugs comes under ACE inhibitors. Next, ARB. This one suffix having sartan. So what are the drugs comes under this category? Losartan, candesartan, valsartan, delmsartan, irbesartan, olmesartan. So what are the sartan? Losartan, candesartan, valsartan, sartan, delmsartan, irbesartan, and olmesartan. So this one bril suffix, here sartan suffix. So these are the drugs inhibit RAS. Beta blockers, propranolol, then metoprolol, then atenolol. These are the drugs. Then calcium channel blocker, phenylalkylamine, benzothioxyphene, then dihydropyridines. These are the drugs. End with pine, nifedipine, phalodipine, amlodipine, netridipine, lesidipine, lercanidipine, benidipine. These are the drugs comes under dihydropyridines. Then diuretics, thiazide, hydrochlorothiazide, chlorothalonil, then intapamide. These are the drugs comes under thiazide category. Then vasodilator, then arterial dilator, then venodilator. Arterial dilator, hydralazine, minoxidil, diazopam, side. In this one, nitro so vasodilator, arteriolar dilator and venodilator. In this one, hydralazine, minoxidil, diazoside. This one, nitroprazide. So five different type of drugs and the mechanism of action already known. Now what is the rules? The rules says that ABCD rule. What is ABCD rule? A for ACE inhibitor, B for beta blocker, C for calcium channel blocker, D for diuretic. Always if patient is less than 55, okay, patient is less than 55 years, it start with one drugs, either A or B. If the patient is old, more than 55 years, start with one drugs, C or D. Okay, less than 55, start with A or B. More than 55, started with C and or D. So always start monotherapy. First we start single therapy only. So according to this British Hypertension Society guidelines, there are four steps rules. There is a 4 steps rule. Step 1, start with monotherapy. Either start with A or B or C or D. Who will decide you will start with A or B or C or D depending on that? Okay, who will decide it? Depending upon their comorbidity of that patient. Okay, comorbidity of patient, multiple factors depending on affordability of that patient, depending on many factor will decide the best for that patient. Okay, so these are the factors, mainly comorbidities. Multiple factor will decide. So we have 4 option, A, B, C, D. If patient have headache, feeling, dizziness, frequent headache. Okay, so incidental finding of hypertension. Okay, that patient having blood pressure. On one reading we cannot rely. Okay, we can do more than 3 times, at least 3 times, then only we confirm. If every time the blood pressure is elevated, it is more than 120 by 80, and there is fixed classification also. So doctor will start that patient on antihypertensive drugs. So either we started with A or B or C or D. So depending upon that multiple factor, doctor will decide what is the best for that patient. Because for A, B, C, D, doctor assume you know that they knows that adverse effect of also. Doctor ask that patient history first. Okay, patient doctor ask the patient about other comorbidity, or you diabetics, or they have any other problem like ecloma, they have prosthetic hypertension, all the things they want to know. Okay, whether they have angina or they have MI or other comorbidity they have. Okay, doctor should know which drugs to give them, okay, for particular diseases. So doctor must know that contraindication also. If that blood pressure is controlled, it is good. If it is not controlled, increases the dose. If it is still not controlled, start with okay, start with bitherapy. We will give 2 drugs out of A or B. Start one of them. out of C or D, start one of them. So doctor can choose out of A or B, choose out of C or D. So we have various combination. Start with bitherapy. Bitherapy means two drugs together. Double therapy. It is still not controlling. Start with triple therapy. A, B, start with C and D also. Give A or B, one of them along with C. Okay. If it is not controlled, it is a malignant hypertension. So that time all four therapy, four things, A, B, C, D, four things we want to give, because this one is the malignant hypertension. Malignant hypertension means 200 by 80, 180, 120. Malignance. 200 by 120. This one is the malignancy hypertension. Malignant hypertension time, we will give four drugs together, A, B, C, D together. So malignant hypertension 200 by 120. So doctor should know that contraindication. Say for example, angina patient never give vasodilator. Then diabetic and hyperlipidemia patient, we never give B blocker and diuretics. Then asthma patient, B blockers. Then chronic heart failure patient, never give that calcium channel blocker. So doctor should know what should preferred and what should not prefer drugs. Okay. So say for example, angina patient, they will give B blockers and calcium channel blocker, not recommended vasodilator, like that. These benign prostatic hypertension, uh, drugs of choice, A blocker and CCP. Then yearly isolated systolic hypertension, diuretics and calcium channel blockers. Diabetics and hyperlipidemia condition, we want to give this type of drugs, never give B blockers and diuretics. So these are the some other diseases. These are the drugs recommended, this one not recommended. In pregnancy, female hypertension occur means what to give and what not to be given. So this is the mnemonic better mother care during hypertensive pregnancy. These are the drugs recommended: beta blocker, methyl dopa, clonidine, then dihydropyridine, then hydralazine, then prozozine. These are the drugs recommended. What are the drugs? Beta blockers, then methyl tofa, then clonidine, then dihydropyridine, then hydralazine, then prozozine. These are the drugs. So we want to avoid during pregnancy time ACE inhibitor as well as ARP, diuretics, non-selective beta blockers and sodium nitroprusside. These are the drugs must avoided. So in this video, last chapter, CVS antihypertensive drugs. 5 drugs, the mnemonic A, B, C, D and V. These are the example of drugs. According to British Hypertensive Society guidelines, 4 steps we want to follow. Then what are the drugs preferred for what are the diseases? What are the drugs avoided? That pregnancy time, safe hypertensive drugs avoided during pregnancy drugs list. Thanks for watching.